Hi, this is Congressman Bob Goodlatte. More than 90% of all American employers are small businesses, and they generate more than 70% of the new jobs created in the United States each year. Small businesses are the backbone of the American economy, and yet Democrats in Congress are poised to pass a 2,000-page, trillion-dollar health care bill that will kill jobs and devastate America's small businesses. The Pelosi health care bill contains thousands of new federal regulations, mandates, and new big government programs. To pay for this massive new government expansion, the legislation contains $729 billion in new job-killing tax increases imposed primarily on small businesses, even while the country remains in a serious recession. Included in the hundreds of billions of dollars worth of new tax increases on small businesses is an 8% penalty tax on payrolls of employers who cannot afford to provide health coverage that meets federal bureaucrats' standards. The Congressional Budget Office has confirmed that this tax could reduce the hiring of low-wage workers and could lead to wage stagnation as businesses are forced to divert funds to comply with new federal taxes and mandates. Estimates indicate that as many as 5.5 million jobs could be lost from this tax alone. This is particularly unacceptable at a time when unemployment is at a 26-year high. In addition, the bill increases the top tax rate for small businesses from 39.6% to 45%. Small businesses, which employ half the U.S. workforce, are an integral part of our national economy. That's why I intend to vote against a government takeover of health care that will inflict even more harm on our nation's small businesses and make jobs even worse. Instead, we should focus on a broad bipartisan bill that has broad public support and would include things like dealing with portability of health insurance, pre-existing condition exclusions, making sure that individuals and small businesses can buy insurance policies across state lines, making sure that everyone, individuals and small businesses, have the same tax deductibility of their health insurance premiums that large corporations have, and making sure that we have medical liability reform that will cut down on the amount of defensive medicine that is practiced by doctors and hospitals. If you couple these with an effort to allow small businesses and individuals to join into large group plans of 50,000 or 100,000 people so they can spread the risk and negotiate with insurance companies to get lower rates, these are the kind of reforms that could easily pass this Congress and do some real good to lower the cost of health insurance and make it more available to more people.